Good evening, everyone. Happy Monday. This is the calling to order the regular Boulder County Board of Health meeting on Monday, March 14th, 2022. Can I announce all board members who are present to announce themselves? This is Greg Thomas, Board President.
This is Morgan McMillan, Board Vice President.
This is Brooke Harrison, Board Member. Landry Fagan, Board Member.
This is Lindy Hinman, Board Member.
Okay, we have all board members here, so we do have a quorum. Staff, let's see. I guess what I would say, Camille, is for anybody who's presenting on the agenda tonight, if they're BCPH staff, can we have them introduce themselves? I think we have a few externals.
Yes, President Thomas, do you want them to do that as they are presenting, I would assume, to keep things moving along?
I think that's fine. Yeah, I mean,
Fair enough. Yes, that's fine. We'll be
Okay.
prepared to do that. Thank you.
Thank you to everyone who's on the participant list. Looks like quite a few staff whose names I recognize, so thank you. Okay, so this regular meeting of the Boulder County Board of Health called to order at discretion of Executive Director Camille Rodriguez. Notice of this meeting was posted on the Board of Health's website as required by law and included the Zoom teleconference information. We're still in the COVID-19 pandemic, and so we are continuing to meet remotely as is allowed by the bylaws. So with that, we will move on to agenda item 1, public comments on unscheduled agenda items. Do we have any public comments this month?
We do not.
Okay. That is okay. So now on to item 2, which would be approval of the February 14th regular meeting minutes.
This is Morgan. I move to approve the February 14th regular meeting minutes.
This is Brooke, I second.
Okay, all in favor? Aye.
Aye.
Okay, thank you. Item 3, 2022 legislative update and approval of the 2022 legislative agenda.
Thank you, President Thomas. This is Camille, and good evening to all, and especially to members of the Board of Health and to all the staff and public that are with us this evening. Our first item tonight for your presentation, we have 2 staff, Lane Drager and Heather Crate, and they are here to give you an overview of our legislative agenda and give you, as the board, an opportunity to approve the 2022 legislative agenda. So I'll turn it over to staff. Thank you.
Good evening, board. My name is Lane Drager. I work in Environmental Health Division, and I'm also one of the policy co-chairs for the CALFO Policy Committee. And we're also going to be joined by some of our colleagues from the Commissioner's Office, their policy staff. But tonight we're going to give you an overview of the legislative efforts that we have going on and our collaborative effort with the Commissioner's Office and with CALFO. Give you that sort of overview. Ultimately, at the end, we will make an ask of you to look at that legislative priorities that the Commissioner's Office has already adopted and look for the Board of Health to also adopt that as our marching orders for policy efforts that the staff will continue to pursue. So first up, we're going to share some time with our Commissioner's Office. I'm going to turn it over to Mark Resin with the policy team at the Commissioner's Office, and they're going to give you an overview of some of their efforts and the policy priorities that the county has set already.
Well, thank you very much, Lane, and I really appreciate this opportunity to present to the Board of Health. My name is Mark Resin, and I lead the Boulder County Commissioner's Office policy team, which includes Cindy Copeland, who was able to join us this evening, and also Summer Laws, who has an unexpected conflict come up, and she isn't able to join us this evening. We really appreciate this opportunity to come present to the Board of Health. We certainly hope that someday soon we'll be able to do this in person. This is one of our favorite presentations that we get to make because we have a strong collaborative working relationship with Board of Health, with public health staff, and really appreciate the great collaboration we have with the public health team on legislative and other priorities that are shared by both the county organization and by public health. We thought we'd talk some with you about those priorities this evening, and then are happy to answer questions about our work and the role that we play here in the commissioner's office. And I think it'd be helpful to go to the next slide, please. Okay, great. Just a little bit of a primer here on the Colorado General Assembly. The General Assembly meets for the first 120 days of the year, thereabouts. They convened this year on January 12th, I believe, and will meet through early May. 100 members of the General Assembly, and we wanted to point out to you that 8 members of the General Assembly represent some portion of Boulder County. So some of these representatives have their entire districts within the county. Some represent Boulder County and other counties as well. So we have 5 members of our delegation in the State House. That's Representatives Junie Amamali, Tracy Burnett, Matt Gray, Edie Hooten, and Karen McCormick. And then 3 members of the delegation that serve in the State Senate, Senate President now, Steve Fenberg, Senator Tammy Story, and then also Senator Jaquez Lewis, who not too long ago was on the Boulder County Board of Health and sitting in your chairs as we were giving these presentations. So that's the 8 members of our delegation. We work most closely, no surprise, with the 8 members of our delegation, but also we work across all of the members of the General Assembly in advocating for county priorities, and oftentimes, whenever we can, in support of priorities that are identified by public health staff, and for example, through CALFO and other opportunities to lobby. As you can see from the numbers, the Democrats have the majority in both the House and the Senate. And just to be frank, that's been helpful to us as we've been looking to advance county legislative and state budget priorities. I'll add that we have a very active lobbying effort on legislation, tracking a good chunk of the 600 plus bills that will be introduced in a typical legislative session, lobbying usually about 25 to 30% of those bills in some capacity, those that impact county governments in particular, of course, and then other parts of the state organization and the state budget. I will just say going into next year, it'll be important for us to track the 2022 legislative cycle, and in particular, the impact that redistricting will have on state elections. All of the members of the General Assembly, well, half of the members of the state Senate and all the members of the state House will be running for election or re-election in the fall. All of them will be impacted by newly drafted and newly designed districts. So it'll be really interesting to see how that impacts the makeup of the parties, the majority and minority at the General Assembly. And perhaps the last thing to add on this slide is that the county has always been in a really good place in respect to leadership in both the State House and the State Senate. As I mentioned, Senator Steve Fenberg from Boulder is currently the president of the Senate. In past years, we've had speakers of the House, a lot of the leadership in the respect to committee chairs, for example, are coming from the Boulder County delegation. So it puts us in a good place to advocate for county priorities when our members themselves are in leadership positions within their caucus and within the General Assembly itself. Happy to move to the next slide. Okay, and as Lane mentioned, the county adopts on a annually a set of priorities that are defined and called out in our annual state legislative agenda. And we provided a very brief kind of compendium of the policies that are included in the 2022 state legislative agenda, which was adopted by the Board of County Commissioners a little less than 2 weeks ago. We work closely, as you can see, the three of us on the team, Cindy, Summer, and myself. We work closely with public health staff. And a number of years ago, we formed a group, a committee that we call the Health and Human Services Policy Committee, that includes membership from public health, our Housing and Human Services Department, and our Community Services Department to advocate across those three departments and be sure that we're tracking closely the legislation that impacts those departments and those agencies. So this is a really great way for us to get insight from our subject matter expert staff. We, as the policy team, cannot be experts on everything. We kind of consider ourselves, in some respects, generalists, but we're pretty good at connecting with the people in the organization who really know the ins and outs of any particular issue, and then being sure that we're conveying that expertise to our legislators and others who need to hear it because there's a particular piece of legislation that impacts their issue area, their focus area, that might impact the county's ability to provide services to our residents and constituents. And we want to make sure that that voice is down at the Capitol, influencing outcomes in front of the General Assembly and ultimately those bills that reach the governor's desk. The Human Services Policy Committee is a really great tool to help us do that work and to be sure the county voice is well represented. We work very closely with a number of organizations. You can see their logos on the bottom of this slide. Really appreciate the great leadership that Lane and Joe and others have provided at CalFO over the years, and really have excellent working relationships with Frontline, the lobby team for CalFO, and are collaborating with them on a regular basis in support of legislation that impacts both the county and public health. And then we have other organizations that we support and participate in. CCAT is Counties and Commissioners Acting Together, a coalition of counties from across Colorado that work together on a wide variety of issues, for example, in the affordable housing space and mental health, behavioral health. Summer closely tracks the work of CHSDA, the Colorado Human Services Directors Association, again, making sure we get the HHS perspective and are advocating for our Human Services Department. And then Cindy in particular has a close working relationship with CC4CA, Colorado Communities for Climate Action, which, no surprise, advocates in the climate and environment space. And as an organization, Boulder County was instrumental in supporting and founding a number of years ago. So the point here really is that we work closely internally with county staff and then externally with the organizations that are also out advocating for our priorities and legislation that supports county priorities. Next slide, please. All right, Cindy and I are going to tag team a little bit here on this slide, and then I think that's the last item that we'll have. The commissioners adopt a state legislative agenda every year, as I mentioned, and it's a very broad document, kind of covers every set of issues that are in need of some support from the General Assembly that the county cares about. It's not everything the county cares about, but those particular things that we need help from the General Assembly to achieve. Cuts across everything from aging services to land use to wildfire resiliency to tax and finance, you name it, covers a lot of ground. So in addition to adopting that broad set of priorities, we narrow those down to priorities for a particular legislative session. And what you have on this slide are the priorities that the commissioners have identified for 2022, legislative priorities and state budget priorities. And we're going to just get into some of the details here real quick. Cindy and I will take turns here. Quick, wanted to mention on the health and behavioral health side that we have, just getting my notes. So we know that that behavioral health and mental health are topics of major importance to many county constituents. And so this session, we're seeing a lot of legislation that addresses issues such as healthcare access, healthcare affordability, mental health care access, and substance abuse treatment access. In addition to the wide number of bills that are coming out of the Behavioral Health Transformational Task Force, which is looking at how the state is going to spend its ARPA dollars. A couple of bills that we're tracking very closely, engaging with in this space, including the Cover All Coloradans bill, which is being brought forward by next. There we go. Okay, great. Next up is air quality, and Cindy is going to speak to that real quickly.
Yeah, thanks, Mark. So I focus on air quality and climate policy for us, and covering environmental legislation this year. And so top environmental legislative priorities for us include legislation to address ongoing ozone non-attainment in the Denver metro region. I'm sure you're all very familiar with that. And the need for greenhouse gas emission reductions across the state. So there are already a number of bills that we're tracking that have been introduced, and they speak directly to the climate crisis or to air quality. And we're also looking forward to, even though it's getting a little late in the session, a few more possible bills to come. So we're really supportive of legislation in this area that will bring us much needed near-term emission reductions. And I will pass it back to Mark to cover wildfire resiliency.
Thanks, Cindy. Yeah, air quality is a high priority this year for the county. We'll hear a little bit more about that on the budget side too. And then wildfire resiliency has been a priority for the county for a number of years. We were have been working on both additional funding for wildfire mitigation and also improvements to how wildfire is handled in the state. Long before the Marshall Fire. Unfortunately, wildfire in Boulder County is a common issue and one we've been working on for a number of years. We have been supporting a bill that's out right now, House Bill 1111 from Rep. Mobley, which builds off of previous legislation that actually Commissioner Levy passed when she was in the General Assembly and that 1111 will provide reforms and new coverage requirements for property and casualty insurance policies that will apply in the event a home is lost in a declared fire disaster. So this is important work that we've been focusing on for a while and we'll continue to spend time on, and certainly the Marshall Fire just brings it all into perspective for us. On the budget side, we're very active in lobbying the state budget, and in large part that's because the county governments are statutory subdivisions of the state, and decisions that the General Assembly makes and how it spends its state dollars that come down to the county are very important and impact our ability to meet the needs of our residents and serve our constituents. So we spend a significant amount of time lobbying the state budget, and that's almost a 12-month a year project, because the budget development starts in the summer and ultimately leads to the long bill that's adopted by the General Assembly in the late March, early April timeframe. We did want to just mention in this space that, again, we're looking to support funding for disaster recovery and resiliency, looking to see more money directed to wildfire mitigation, and now looking to support legislation that might support those impacted by the Marshall Fire, whether that be through helping them rebuild, grants and other approaches to help them rebuild those who lost their homes. And then Cindy's going to speak to environmental health.
Yeah, so Governor Polis has requested $424 million in one-time general fund investments. And that's for a broad set of targeted initiatives that include greening the transportation system, funding for electric school buses, decarbonizing the industrial and aviation sectors, and additional resources for CDPHE. And those resources are for increased air monitoring and increased funding to hire new air permitting staff. And we support these budget proposals. They're necessary steps to improve our air quality and reduce greenhouse gas emissions. But the budget request is still being debated in the Joint Budget Committee. So it remains to be seen how much of that money they will get. This is part of the request is being termed by the administration the air quality transformation, and so we continue to push for supporting that and the transformation along with the increased emission.
Expects to finish up development of the state budget this week. It will receive the March revenue forecast on Thursday, true up the state budget to the expected revenues for the state in the next fiscal year, and then that bill, what's called the long bill, the state budget, will be introduced perhaps as early as next week, and the General Assembly will debate the long bill over the next couple of weeks. We do spend a fair amount of time lobbying the budget, and human services is a key component of that. Two pieces that we're working on are what's called county administration, which is the funding line that supports administration of a big chunk of the human services programming that we offer in the county community. And then in particular, focus on the child welfare line and ensuring that we have the funding necessary to support full funding for the child welfare system. Always a high priority for the county, and again, one for us this year as well. And that's, I believe, the last slide that we have. I think maybe Heather and Lane are going to take it from here.
Thanks, Mark, and thanks, Cindy. They're definitely being very modest, saying that they are generalists. They have a huge depth of knowledge, and we rely on them. They give us a lot of heads up on issues that are relevant too. So it's been a great relationship working with them, and also having some of our former colleagues at public health staff like Cindy, who are now embedded in the commissioner's office. So we're very well situated, and it's been very fortunate to have the relationships we do. So I wanted to share a little bit about CALFO, so the Colorado Association of Local Public Health Officials, and help continue to shape why we're asking you to look at this larger policy document that the commissioners have adopted. These are some of the key priorities that CALFO focuses on, really that local public health system. So our authorities, our funding infrastructure, all those partnerships, as well as the state infrastructure and how it relates to supporting our local public health efforts and authorities. We've also broken out into very high levels. Similarly, in the commissioner's document, these larger areas that most of our programs work falls under. So you can kind of see that list of the other policy priorities that CALFO focuses on. And the commissioner's document is great. It's very broad, but as you'll notice, a lot of the issues are embedded in cross multiple types of departments. So the policy committee that the commissioner's office runs, a lot of those issues transfer across the department. So when we think of the social determinants of health, so much of what housing and human services does impacts health. And so we know that. Similarly with community services efforts. So it's not a neat bucket to say, this is all the stuff that public health works on, and this is all the stuff that housing human service works on, and here's what community services work on. Much of it overlaps so that we're all working on similar issues. And so that collaboration, as well as this overarching document, gives us those broad areas to focus on. So as we see health related issues embedded in subject matter, it gives us that flexibility to work on it. So CALFO has been working in all these different spheres, and Heather and I will talk a little bit more about some of the specifics. I'll give you an example of a bill that we're working on that we're concerned about. So we not only advocate for policy, we also sometimes advocate that bills should not pass. So there's a bill that's looking to potentially limit or add additional layers of oversight for disasters. We don't expect it to pass, but CALFO is going to help try to assist that process of not making it pass. So CALFO will be testifying against its House Bill 1238, and it looks to add layers, not just at the state level, but at the local level. So it would start to move some of the authorities that the Board of Health currently has to be overseen by county commissioners. So it would limit some of your capacity to oversee disasters and put things in place. And so we don't see that as a positive thing. We see that control both at the state level for the governor and the health department, as well as the Board of Health, is where we want to see those kind of disasters overseen and not see additional elected officials added into the mix for making decisions on whether disasters are still occurring or not. And if you're interested in more of that, we're happy to share links to that. But at this time, I'm going to pass it over to my partner. So Heather's also on the CALFO Policy Committee, and Heather will share some more of the priorities and some of the specific efforts on some of the bills that we've been working on.
Thanks, Lane. Good evening, everyone. One thing that we wanted to highlight were what the public health specific priorities that we see within the 2022 Boulder County legislative agenda. So we just pulled out a lot of those pieces that our teams have worked with Mark and Cindy in summer to really outline. So things like family planning, issues that relate to immunizations, oil and gas, access to healthcare, health equity, mental health, food safety. You can see here it's an extensive list. And all of these issues are really built into that larger, broader legislative agenda. They really span across all of the work we do within our different divisions, departments, within public health. So as far as what it looks like for our staff to participate alongside the Boulder County staff around legislative priorities, we often work in partnership with Summer Laws in particular, who was a public health staff as well, to develop talking points, to help identify different legislators we want to reach out to encourage votes that would be supportive of public health. We also have our staff have submitted written testimony, been asked and called to testify at the state legislature. I, for example, just had the opportunity last week to testify on HB 1279 related to reproductive health equity, which really impacts a lot of the work that we do, in particular in family health and community health. And I have a colleague testifying later this week on HB 1064, the tobacco flavor ban, which is really interesting to us, as that's some work that our Tobacco Education Prevention Partnership Program supported within City of Boulder not too long ago. So really, this is a partnership between us, the county offices, CALFO, to identify these areas within public health and provide input on state level legislation that impacts us at the local level. So it's that opportunity for a holistic approach to policy that comes up. And next, we're gonna open it up for any questions that you all have, board members. See if there's anything we can clarify. Yeah, I see Morgan.
Yeah, thanks, all of you, for all the great work that went into this. And in particular, I don't remember, maybe I'm just not remembering, but I don't remember the principles part being such a strong statement in the past. So it was a nice thing to see this year in terms of the legislative principles laid out, and certainly the priorities are thorough, and it's so nice to be in this community working on doing all this good work. So thank you. I had a couple of questions. One is about, Heather, you just mentioned testifying, and just, what are the opportunities for board members to support the work that you're all doing, either through testifying or through submitting letters of support for specific legislation? Are there ways that the board can strengthen our support, in particular at the state, for the legislative work that you're doing? And then what are some opportunities that we might try to reach out and engage all of those engaged folks who have been involved in public health meetings for the last couple years to try to maintain some of their engagement around public health priorities.
I can start with an answer. One of the biggest things that's so powerful for us is this actual agenda item. So it is not common, I would say, across the state for boards to sort of empower their staff to be as active as Boulder County has been in that policy arena. So this is, I don't want to undersell how massive it's been to have board support for so many years to do this. But there are, I think, opportunities depending on kind of the subject matter that you're interested in. Oftentimes, when we're looking for testimony, as CalFO is organizing things, or certainly the commissioner's office, they're trying to make decisions on what's going to be the most impactful testimony. So both, being a board member, that I think carries weight and can be helpful in certain committees, as well as your network of folks. So those personal stories are incredibly powerful. So folks that you may know in the community who are impacted by issues, who can come tell their personal story. We're very good at data, and that's something that we're very proud of, to be data driven, but that doesn't always carry the day. And when there's testimony given. So really those personal impact stories that are very emotional are often very powerful too. So as there's subject matter that's very near and dear to your heart, and as community members, please feel free to reach out and we'll help try to make some of those connections so that we're ready in advance. That's another important piece, is things move very fast, and especially after the budget starts to get solidified, there's going to be a whole lot of movement, especially for those bills that had those fiscal impacts. So having people prepared in advance for testimony is very powerful and useful to us. So anything that, again, subject matter wise that you're interested in, please reach out, and then I'll defer to any other colleagues who have thoughts to share.
And I'll just add to that, if anyone, is there like a system for call to action? Like, hey, we know that this is coming up and we are looking for people to speak on, to testify, and, these are the points that we want to make? Or is it sort of we reach out and let you know what we're interested in?
I think it could be both. Speak just for CalFO specifically. As we know, things are going to be coming up in committee and looking for testimony. We do specifically kind of put a call out. So there's an opportunity to move that also to the board. Internally to BCPH, we've tried to create a group to share policy issues. So Heather and I are often giving updates and kind of sharing, here's the latest, here's what we're monitoring, here's what we're actively working on as far as CalFO. The commissioner's office is often sharing things or asking for our opinions on things that relate to health. So there's a number of ways we're identifying, but we're also looking for things that other people are aware of. I also joined the Colorado Public Health Association's policy group. And so I also see what they're identifying and what they're active on. And so we try to keep that network broad to learn what's going on. But sometimes things move pretty fast when things are moved to committee. You sometimes only have days or maybe even less than that to try to pull somebody together. So as much advance notice really is helpful in knowing who would be a good speaker and that they're already pretty prepared for what they want to say.
I think Brooke had your hand next.
Yeah, quick follow-up too to what Morgan was saying. It would be nice if we could be kept in the loop a bit more during their legislative session on what kind of activity you are taking on specific bills. I try to track it myself, and it's pretty much impossible to track the legislative session completely on your own. So some updates, kind of like what Morgan was asking for, would be nice. And then in regards to the priorities part, I know that there are potential bills coming up this session that would specifically look at the non-compete contracts that are imparted to a lot of the mental health county providers, like mental health partners. Would we, as a department, legislatively, would we take no stance on that, since it could be potentially a conflict of interest? Or is there something that you have considered in response to those bills, should they come up?
Mark, do you have any perspective on that? I think for CalFO, things that we are vested in, sometimes we still would take a stance on that. Haven't seen that it necessarily is a conflict for us to still represent how things would impact us. But Mark, have you run into those kind of issues?
Yeah, thank you, Lane, and thank you for the question. I think Lane's exactly right. It's important for us to not only to be sure we're keeping an eye on how the system is functioning and ensuring that it's working well, in addition to who might be involved in the system in any particular moment in time. I know our human services staff, our HHS staff in particular, is looking closely at those issues because they have contracts with mental health partners and others to do that work. So they are paying close attention to how the system operates and functions, and the role that our nonprofit partners play in delivering services to our residents. So it certainly is something that warrants paying attention to and being actively engaged with if there are concerns about the approach being taken by the General Assembly or ways to strengthen bills or change bills so that they're meeting our needs as best as possible. So we'll just plan to stay in touch as those bills come forward. And to the broader point of participation, we are always looking for opportunities to bring county perspective. And by that, I mean the whole county family perspective down to the Capitol. And if Board of Health members are interested in doing that, we can most certainly figure out ways and opportunities to help with, where you could help with that. We have really good, as you've heard, communications and collaboration with public health staff. So we can stay in communication around that and look for opportunities and figure out a way to get those sent out to you. And I actually jotted down a few ideas, Heather and Lane, that perhaps we can talk about offline, including sharing some of our links and other information that we have that we compile on a regular basis.
Yeah, thanks. And it would be really nice to just be kept in the loop, especially on bills that would directly impact the department itself.
Yeah. Yep.
Hey, Cindy, I had a question for you. The 424 million of one-time general fund expenditures. I mean, if it's one time, I assume that is probably more for infrastructure studies, that type of thing, and not for staff or staff development, right? Or staff build out.
Yeah, the 52 million of that is the air monitoring portion and the increased staff portion that CDPHE is specifically asking for. There was a big chunk of it for electric school buses. I can't remember exactly. I think it was maybe around 100 million, but we've already heard that the administration has been told that they're asking for too much for electric school buses. We of course think that would be a huge air quality benefit, and so it's disappointing to hear that. But we don't know the details of those agreements. But yes, the staffing and the monitoring is 52.
That feels like a good one to get the parent, network involved in too. If there's an opportunity to push on that one.
Yeah.
Yeah.
And then, building on Brooke's comment, I'm sure that the department, Lane, maybe through CalFO, you get legislative updates. The department or the county probably gets legislative updates, and I'm just wondering, could that be like part of the director's report if that comes in a PDF?
Yeah, I think that there's several things that came to mind that I'd be happy to share. So on a weekly basis, at least internally, share sort of updates on the bills that we're tracking, as well as the ones that we're actively engaged on. So that's one document that has, I think, so to Brooke's point, not having to sort through all the bills that have been introduced to find ones that might be relevant. We've already done that. And then there's some other sites and they're all nice because there's hyperlinks to the bills. So the
Yeah.
ones that you're interested in, you can go dig in and read the entire bill. You can see when it's coming up in committee. It gives you that leg up to really be aware of where things at. You can see which committees it's assigned to, and again, who's on that committee. This is really where the commissioner's office is very helpful, especially when there's Boulder delegates on those committees to get them prepped on why these are important to us. So that's really helpful. And there's, I think, again, those are, I think, other opportunities too for your voices to be heard too on those things that you're subject matter experts on.
Great, thank you.
Brooke, was that a new hand?
Brooke?
Okay.
Yeah, it's a new hand. I just had a clarification question from what's in the packet. So today we vote to basically support the priorities, correct?
Yeah, that would be our hope. So our
Yeah.
request is that same priority document that the commissioners have adopted for the board to also adopt.
Okay. And so the policy statements, which become more specific, is that really just more informative for us? This is what the county commissioners have determined to be their policy statements. I asked only because, and I said the same thing, I think I said the same thing last year, where these all sound, where it's like, okay, all of these sound great and wonderful. But then when you think about almost every single one of them, you can find something where there could potentially be a bill that a large portion of the county residents may disagree with and find and take issue with. And we would like to hear from them what their stance is as a county resident for these bills. So I'm just curious, again, is this more informational? This is what the county commissioners have already determined, or is this something that we're supposed to provide input on as well?
Well, certainly for public health, I think we're looking for your thoughts on if there are concerns with adopting it as is. We definitely want to hear those. We typically are using it for really those bullets of the subject matter that gives us that breadth. Instead of creating our own document, it really gives us the ability to make sure we are in step with the commissioners, which we always really have been, but this is just an extra assurance that we really are walking from the same playbook. But we use it really for those bullets. As Heather mentioned, it really is a nice document that covers the subject matter that we are concerned with, that we work on throughout all of our programs. And so that's really the focus, as opposed to getting into things that we're concerned could be kind of political hot potatoes. That's typically not where we're engaging as staff. That being said, immunizations is one. So we know that can
It shouldn't be.
create
Sorry.
it can create some polarization. But as public health, we don't want to create situations where we're asking everyone to vote on what do you think. We do want our public health science to drive the day. And so there have been several bills, at least for CALFO, that we've been active that were sort of anti-vaccination bills. They were not likely going to succeed, but CALFO wanted to support the broad network of partnerships, just to look at those bills. And so there are situations where we do know that we may not have a uniform consensus within our community, but are still foundational to the work we do in public health that we still want to advocate for, or potentially make sure that we don't weaken systems that we already have in place. So I don't know if that's exactly the area that you were thinking about, Brooke, but there are some of those situations where we know not everyone will be in agreement, but we know that these are really foundational public health issues that we want to really advocate for or make sure we don't see weaken.
And Brooke, I feel like we did discuss this a little bit last year, and I think, I think we, as a board, my view is that we want to give the staff, the trust in the staff also who are down there every day to be doing the work and working with partners, and whereas, there might be something that is supporting one of the policy statements, but it's not good policy, or the way it would be implemented is not good policy. I mean, I think the staff is quite knowledgeable about what the impacts of that would be. And in terms of which ones to get behind and which ones to
Yeah, I think
Not.
one that particularly I had highlighted some that stood out to me in particular, but I think the one on implementing harm reduction, so support harm reduction legislation and other public health approaches. So that could be Boulder, that could be us lobbying in favor of, say, safe injection sites, which is something that I know is very controversial most across the US and in different pockets. And so I'm not seeing it show up as a county priority, but it is showing up in the policy statement. And so that's just something where I would appreciate if we could have a discussion. I know a build like that's not anticipated, but should something arise that is very controversial, like a safe injection site, if that would be something that we would be open to discussing. Does that make sense?
It does. And I think harm reduction actually filters into several subject matter areas, so not just the substance abuse issues. So we do see that where, those approaches where we don't necessarily get all the way to what we want, but we do want to reduce harm because we know, that's a lot of the legislative processes. You're sometimes chipping away at what you're trying to get. And so if you can get some harm reduction, that is a win versus getting, complete, removal of that issue, which often takes a lot of work. But I haven't seen that specifically introduced as far as location or funding to create injection sites, but that would definitely be something that we would look at. And I don't know whether or not CALFO would take a position, but for things that Boulder County Public Health specifically advocates, that is a little separate from what CALFO does. So that is a piece where we would approach Camille and get her thoughts on how we would want to approach that if BCPH was going to sign on or staff were going to testify specifically.
Okay, thank you.
Okay, so we're a little over on this agenda item. In the interest of moving on, the recommendation, the request is to approve the 2022 legislative agenda. Can we get a motion?
This is Landry. I make a motion to approve the 2022 legislative agenda.
This is Brooke. I second.
Okay, motion and a second. All in favor?
Aye.
Aye.
Okay, thank you very much. Mark, good seeing you
Thank you.
again. Cindy,
Likewise,
good
great.
seeing
Thank you.
Lane, keep up the good work with CALFO.
Well, thanks so much, board. We really appreciate it.
Yeah, thank you. Good night.
Okay, next on the agenda is item 4. Just scrolling back up to the agenda. All right, an update on the Genesis program accreditation.
Thank you, President Thomas, and I'm happy to introduce Community Health Division's Program Coordinator, Mary Feltinsky. I also want to thank the Division Director of Community Health, Heather Crate, for really advocating for the board to have this really incredible update. I'm going to turn it right over to Mary. Thank you so much.
Hello, thank you, board and directors team, for having me here to talk about the Genesis program. I'm very happy to be here, and I guess I just want to give you like a brief minute of background on my experience in home visiting. So I am a public health nurse with a nursing degree from Johns Hopkins and a master's degree from Berkeley. I started my career doing home visiting policy with the Federal Department of Health and Human Services, and I've worked on home visiting programs in Maryland, California, and Colorado. But I'm here to talk about our program here today, Genesis, and our plan to become fully accredited by Healthy Families America. Next slide, please. So the Genesis program was created 30 years ago to meet the needs of the growing teen parent population. So at that time in the 80s and 90s, teen pregnancy rates were very high all across the country. And health departments and social service departments said this is an issue that we must address, and it's an issue we can address. It was seen as one of our winnable battles. And so Boulder County created a homegrown program that matched teen parents with former teen parents in a mentoring relationship. So one-on-one home visits in order to help them get the best start in life. So our staff has been on the job. We have decades of experience on the Genesis staff today. And then just a unique reality is that our staff, half of our staff are not degreed. So this is a program that makes room for paraprofessionals to be trained and on the job and work in this capacity. So next slide, please. So while teen pregnancy has seen as the winnable battle, many people say, "Oh, we don't have teen parents anymore. Didn't we solve that?" And while teen pregnancy rates have fallen dramatically, we still have many families that we're serving in the county. So last year we served 237 families all across the county. We serve people anywhere they live in the county, including in the mountain communities. The majority of our clients, however, are in the cities of Longmont, Boulder, and Lafayette. Next slide, please. So as I mentioned, so Genesis is specifically targeted to teens. So we have staff who are experts on working on folks at that stage of adolescent development. Again, it's a peer support model, excuse me. We have bilingual and bicultural staff, which is important. About 60-65% of our clients are Hispanic, and up to 50% do speak Spanish, not monolingually, but at least speak some Spanish at home. In addition to the home visiting component, we also do what we call pro-social groups. So it's opportunities for our clients to get together with other clients, because we know that teens can be very socially isolated when they have a child. Their friends move on to do other things, and they are kind of stuck without that support. So we do things like, as on the first slide, take them to the pumpkin patch. We go to the children's museum. We go to the library. And so that creates a social support network for clients. And then another crucial component is providing tangible supports, because in addition to social isolation, teen families are incredibly financially disadvantaged. So we provide things like car seats and cribs and children's books and diapers to help get them through this really crucial and potentially crisis period in their life. So with all these components, all these things we've been doing for all these years, Genesis has collected data. Genesis has documented results in many domains. But one of the areas that we have felt is more and more important in the current funding, the way funding is provided today, is to be affiliated with an evidence-based program. So next slide, please. So we have spent some time looking at how we can connect with an evidence-based program, because right now, just about any grant program that you can apply for wants you to say you're an evidence-based model. And so we've Healthy Families America, which is run out of Prevent Child Abuse America, fits this and fits our model very well. And I'll tell you a little bit more as we go along. Next slide, please. So Healthy Families America is in 38 states. It serves tens of thousands of families every year. And so we're very excited to have such a network to connect to for resources. Next slide. HFA has documented outcomes through numerous published studies of their randomized controlled trials in these domains. And you may have heard of the McV outcomes. So what the acronym is Maternal Infant Early Childhood Home Visiting Program. And so it is the major federal funding of home visiting programs. And in order to be recognized by McV, you must have domain evidence of progress in the domains that they set out as their priorities. So HFA has done that. And in addition, HFA meets the requirements for the Families First Prevention Act, which is prevention funds for child welfare services out of 4E. Next slide, please. And so the way that HFA accomplishes these outcomes is by focusing intensely on the relationship between parent and child. So the way this manifests, and which has been a shift for Genesis, is that at every home visit now, we're observing and we're documenting that parent-child attachment. We're also getting more training to make sure we're coming from a trauma-informed approach, because frankly, our clients often have had poor starts in life themselves. They didn't necessarily have strong adult role models or caregivers to turn to. And finally, reflective capacity. So reflecting on this, the staff reflecting on how they did at each visit and how can I do better. These are components that we are looking at every week. Next slide, please. So what will accreditation require of us? So we have to demonstrate that we're meeting 153 program standards. We have to increase the intensity of our services. So for most of the pregnancy and the first 6 months of life, home visits will now be weekly. And then in order to move to biweekly or monthly, we have to make sure that families have met certain goals. Each of the staff receive an hour and a half of supervision one-on-one from me every week. And during that time, we will review every case on their caseload and their progress every month. Next slide. And so one of the things is HFA has been such a great match for us because it is very flexible. It's not a program that says, on your first visit, you do this, and at month 1, you do this, and at 2 months, you do this. No, it's that every time you go into that home, you're working on how is this parent and how is this child, how are they interacting, how are they communicating, and that relationship is the most important thing. Even if the family's facing an eviction, they've lost their job, they're having a health crisis, while we will address case management of all those issues, the focus is on how is that parent doing, because we know from the evidence through ACEs that a strong parent or caregiver can actually protect the child from all these adverse things that are coming along. And so that's our focus while we help them meet their family goals. Next slide, please. So we will be going through a 2-year accreditation process to accomplish that full accreditation. We have required trainings. We are aligning our data systems. We're reducing our caseloads to allow for that increased intensity of services, bringing us more in line with the other home visiting agencies in the county. We'll be looking for more funding, and we'll participate with all the other home visiting programs on our universal home visitation efforts. Next slide. And just how doing this will help our county meet our universal home visitation goals is that we make sure that Boulder has this wide range of high quality programming. So for different needs, families have different opportunities for support. So when we start Family Connects and families are getting home visits after a birth of a child, we'll make sure that there are services for those nurses to refer to when they identify these high-risk families, such as teen parents. We'll focus on family goals, so families will have some choice about what kind of a program they want to engage in. And also, we will always be voluntary. No county family is ever going to be forced to have Genesis services. Next slide. So I would be happy to answer any questions anyone has. And thank you so much for the opportunity.
Thank you. Healthy Families is great. I worked with them in Massachusetts. I think it's a great partner.
Thank you.
It sounds like a great program and a great affiliation to have. Are there any potential drawbacks for you all? Like, will it limit any of your flexibility or any other potential drawbacks? Or is it all just win-win for the most part?
I think it's a lot of work. So I don't necessarily think they're negative outcomes because it is flexible. We haven't found anywhere where it conflicts. There are some nitpicky negotiations I have to do about the way we do business and the way they want to do business. And it will be a lot of work. That's the crunch, but I actually feel quite confident that we can meet all the requirements.
Excellent.
Thanks, Mary. Is there a periodic reaccreditation?
Yes, so after accreditation, I believe for a program of our site, it's either a 3 or 4 year reaccreditation process.
Likely the initial lift is the heaviest lift, I would assume.
Yeah, for example, we have to write an entire policies and procedures manual. After that, it's going to be an update. It's not going to be starting from the beginning. So it should be easier through time. Though they just went through an entire update of their policies as of January 1. So existing sites are having to update, whereas we're just starting using the new policies.
Okay, good to know. Thank you. Okay, well, thank you very much for that update, Mary. Looking forward to hearing the eventual outcome here, but yeah, you're right. You do have a lot of work in the short term. I don't think there's an action to take on this agenda item. So,
no, this was hopefully just an informational update.
Yep. Okay, thanks again. Item 5, COVID-19 data policy and program update.
Thank you, President Thomas. No action on this item either, but I'm happy to bring to you data epidemiologist Steffi Goodman. I'm going to pass it off to Steffi now, and also we will have Community Health Division Manager Heather Crate and Communicable Disease Program Manager Carol Hellwig also participating in this portion of the presentation for the Board of Health. Steffi, go ahead.
Good evening, everyone. Thank you so much. My name is Steffi Goodman, and as Camille said, I'm the data epidemiologist for BCPH. I want to thank the Board of Health and Directors team for the opportunity to present a brief COVID-19 update this evening. First, I'm going to go through the most recent COVID-19 data and then spend a few minutes describing the new metrics and guidance from the CDC. Next slide, please. Currently, this slide is showing the 7-day cumulative incident rate per 100,000, and currently we're at 63.3 cases per 100,000, which is lower than the 85 cases per 100,000 last week. I just want to point out that the shaded area represents the backlog of cases from the state due to the Omicron surge. Next slide, please. This next slide shows case trends among age groups, and I just made it down to the last month of data so that we could actually see what's happening at present without it being super compressed because of the Omicron surge. And what we can see here is that in the last 7 days, the 7-day average cumulative case rate per 100,000 has declined among most age groups. It increased very slightly among 12 to 17-year-olds and 55 to 64-year-olds. And the 7-day cumulative case rate per 100,000 is highest among 23 to 44-year-olds, with case numbers highest among 23 to 34-year-olds. Next slide, please. And next slide, please. I'm going to talk briefly about our impact on COVID-19 hospitalizations. COVID-19 hospitalizations are decreasing in the county, the North Central region, and in the state. Currently, it's decreased by 19% in the North Central region and 25% in the state, with 7 currently hospitalized in Boulder County. Hospitals continue to experience some tight staffing and limited bed availability, more due to the backlog of delayed medical needs that are not necessarily COVID-related illness. Next slide, please. Next slide. And this is the first week in quite a long time where there are no new deaths to report. There have been 126 deaths since May of 2021, and to date we have had 383 total deaths. The average age of death for an unvaccinated person is 72 years old and 83 years old for a vaccinated individual. And next slide, please. And then, yes, and so the 7-day PCR positivity rate is 4.4%, which is about the same as last week. You can see how that curve has leveled off. It seems to me that the reason for this leveling off has to do mostly with the decrease in the average number of tests done per day, just under 400 this week compared to 700 per day in the week prior, and over 1,000 in the week before that. The North Central region has an average positivity of 3.5%, and the Colorado State average positivity is just around 3%. Next slide, please. For vaccinations, you can see that Boulder County, percent of the total population that's fully vaccinated is just under 70%, and 39% have received a booster. That number has not changed in several weeks. We've seen that about 551 Boulder County residents received their first dose of a COVID-19 vaccine this past week, which was 902 last week, with an average of 136 doses administered per day compared to an average of 211 doses per day last week. And I wanted to just note that most recent estimates from the state note that people who are boosted are about 2 times less likely to be infected with COVID-19, 9 times less likely to be hospitalized with severe illness, and 15 times less likely to die compared to people who are unvaccinated. Next slide, please. Estimates show state modeling based on a report from February 16th from the Colorado School of Public Health projects that about 90% of Coloradans are immune against Omicron at this point, although they expect that immunity from vaccines and prior infection will fade as time goes on, but they expect that immunity to remain high into the start of summer. They do note that there's uncertainties related to the timing of waning immunity from infection and vaccines, also the timing and characteristics of future variants that might show up with respect to transmissibility, severity of illness, and immune escape, as well as looking at the timing and target population for future vaccines and availability of therapeutics. And while we celebrate this move back to normal, we want to also keep our eye on the future and make sure that we're monitoring how things are going, working in concert with state and local partners to ensure that there's enough testing, vaccination, and coordination of the federal test and treat model, where people can get tested in pharmacies and then be offered oral antiviral treatment if they're positive. Next slide, please. So I wanted to take a few minutes here at the end and explain the changes within the CDC recently. So we used to have transmission levels. The CDC tracker would track transmission levels across the United States based on case numbers and percent positivity. Next slide, please. Oh, there you go. No, back a slide, sorry. And now the CDC is really focused on community, a metric called community levels. And as we have more and more tools to manage COVID-related illness like vaccines and therapeutics, the CDC has really transitioned away from transmission levels, which is based on case numbers, to a new measure called community levels, which is more based on healthcare capacity and case numbers. And the goal here is to base recommendations and guidance in order to reduce medically significant illness and also to minimize the strain on healthcare systems. As you can see, if you went to this website, COVID-19 community levels at the CDC, they would divide it out into high, medium, or low community levels. And you could search for your state and county. And if you did, you would just see that Boulder County community level is identified as low. And the way to interpret that is that although we continue to see COVID-19 cases in our community, the rates of severe illness and hospitalization and death are low, and the stress on our healthcare system is low. These factors are due to, well, multiple factors, but that fully vaccinated people who are staying up to date with boosters, recent widespread infection, and the availability of therapeutics. Next slide, please. The way the community levels are calculated is shown in this table here. And I just want to point out a few things. One is that the way they look at case numbers is either that there's fewer than 200 cases per 100,000 people in the past 7 days, or there's 200 or more new COVID-19 cases per 100,000 people in the past 7 days. And then based on case numbers, they look at hospital admissions per 100,000 for a 7-day total and the number of staffed inpatient beds. Right now, Boulder County, we have 63.3 cumulative cases per 100,000 people in the last 7 days, so less than 200. We're at 4.3 per 100,000 new COVID-19 hospital admissions in the last 7 days, so less than 10 here in low. And we're also at 2.8% inpatient beds utilized, so again, low. That's how we calculate our county's community level. Next slide, please. The CDC webpage for community levels has some recommendations for guidance based on community level, low, medium, or high. If you go to their website, they have more detailed information, particularly for like congregate living settings and other special settings. But it's also important to look at state and local guidance as well. Next slide, they do have a map of the United States, and you can look at your state and your county. So you can see here that most of Colorado is in low community level. At Boulder County, we're surrounded by counties also in low community level. This map gets updated every week on Thursdays by 8 p.m. Next slide. I wanted to take a couple minutes just to run through how the CDC came to this new measurement and look at how it compares and tracks with transmission levels. So if we start looking here last winter, when it was just past our surge in the winter of 2020, 2021. Next slide. And we can see that in the United States, transmission levels are highest in the Northeast part of the country and sort of mixed all throughout the country. If you look at the community levels, you can see that the hospital systems in the Northeast are starting to look a little bit or showing some strain. Next slide. This looks at the onset of Delta. So next slide. And we can see that particularly in the South, we're seeing a lot of community transmission, high transmission, and we're seeing on the left-hand slide with community level that it is showing severe impact in our healthcare systems, whereas in the Northeast, you can see that community transmission is more moderate and low, and in fact, in the community level, is showing that there's less strain on healthcare systems. Next slide. And so if we look at the peak of Delta, next slide, we can see that there's a severe transmission in everywhere around the country, and in fact, it shows up in the community levels, looking at the strain on the healthcare system. Next slide. And then if we look after Delta, next slide. We're starting to see improvement in community transmission and levels, transmission levels in the South, and indeed the strain on the hospital system is alleviating, whereas the rest of the country up here in the West, there's still significant impact on the hospital system. And next slide. And then Omicron, next slide, please. And we can see again, the country is very impacted by high case numbers, and it's showing significant strain on our hospital system. So I just wanted to run through this quickly to show how well the new community levels is really tracking with what's going on. Case numbers. That's all I have. Thank you.
Thank you, Steffi. If you can go to the next slide, please. I am back again, Heather Crate from the Community Health Division, stepping in right now as the K-12 education liaison for the COVID-19 response. And I'm going to talk a little bit about what we're seeing right now in our K-12 and ECE early childhood settings. As far as what we're providing right now for our recommendations to COVID response, we're really referring schools and ECEs to the CDPHE guidance that's been outlined. Still has really great instructions on mitigation efforts, what to do in the event of a case. Schools and ECE settings are still expected to report cases, positive cases, to us at Boulder County Public Health. And really now what we're doing is working with them to establish routine communicable disease responses. So returning to that contact tracing, case investigation model, and approaching, now that we have such lower cases, as Steffi pointed out, each individual case or cluster of cases in a school with certain recommendations. So we are still working with schools to send out notifications to parents if there's known exposures in their classroom. We're not quarantining doing standard routine quarantines of cohorts. And we're still potentially, if we're seeing clusters of cases or potential outbreaks, recommending additional mitigation strategies if we're seeing that spread. We still continue to have a strong partnership with all our school district and school leaders, our school health teams, our private and charter school health teams, and school leadership. Next slide, please. I did want to discuss what many of you probably saw in the media about so many outbreaks being declared within Boulder County schools. So what this is that during the Omicron surge, there were several schools that experienced the level that CDPHE declares an outbreak, which is 5 cases within a 2-week time period in a school building. So it's a pretty low threshold if we take into account just the massive amount of community spread we were seeing. Unfortunately, there are over 90 outbreaks that were declared within K-12 settings and ECEs, and this occurred during January primarily. And so they just started to be declared recently, and they're going to continue to be declared. They're not indicative of what is occurring now. And in order for these outbreaks to be closed, the school or ECE center has to go 28 days without a single case. Most of our ECE outbreaks, these retroactive outbreaks, are likely qualifying to close on Wednesday. That's when CDPHE looks at outbreaks, is on Wednesdays. However, there can sometimes be a lag from when they're open to when they're closed. We're not recommending any additional mitigation strategies for those retroactive outbreaks. It does pose some communication challenges for us, for our school partners. We did work closely with our partners to help them outline some communication to send to their families about what these outbreaks were. Yeah, Morgan?
Thanks, Heather. Just to be sure I'm understanding, we can't necessarily point to spread within the school setting due to the high level of community transmission that was going on at the time.
Exactly. So what was happening was mirroring community spread. And so we can't say that it was due to in-school, in-classroom spread. So not the most useful declaration of outbreaks. We have had a couple of elementary classrooms to since Omicron and since the removal of masks, where we have seen what we believe to be outbreaks, where there was a relatively large number of children in the class, 30%, who developed COVID within 5 days of each other. And so that's more where we're focusing our efforts, our contact tracing and investigation. It does make it a little tricky though, because they were in schools that already had retroactive outbreaks. And so we couldn't open a new outbreak. And so just working with the schools to really communicate with their families that this is actually happening right now has been a little tricky, but it's just had to be a little more nuanced with that communication with families. Next slide, please. Oh, and I will say, I do want to give some kudos to both our EPI team and our school partners, that the reason why Boulder County looked like we had so many more outbreaks than other counties is because we did a really great job reporting our cases and tracking our cases in the midst of that massive surge. Unfortunately, it didn't seem to benefit us in the sort of like, wow, it looks like we have a lot of outbreaks, but I do just want to give a shout out that the teams worked really hard, both within schools and our team, to track that. But it doesn't feel great to feel like it was penalized. So this is what we have right now as far as current data. There are still some lags just kind of coming out of Omicron, getting our data systems set back up with the schools and reporting. But this is what we have as far as how things are looking for our 7-day incidents in K-12 settings in particular. Sorry, my dog is whining. I don't know if you can hear that. But the green graph is showing overall all K-12 setting data that we have. And the 3 over here, so the green one is elementary schools, the blue one is middle school, and the yellowish one is high school, just so you can see that between January 1st over to February 26th or March 12th on this one. But it just really shows you how it tracked with what was happening in our community at the time. And this, these are just including the schools where the data is most up to date. So it's not a total picture. We do know that our elementary cases remain the highest, with a lot of our cases in the kindergarten through 5th grade levels. Next slide, please. So, and again, in alignment with what Steffi talked through, our case rates are much lower than they were during the Omicron peak. I just shared that, the K through 5th piece is where we're seeing a lot of our cases. Again, the cases, the outbreaks that we have seen in a couple of our elementary school classrooms. We do know that about 50% of our students in that K-5th age range are not vaccinated. So that's just a little more concerning that this population in particular doesn't have as higher rates of vaccination. Next slide, please. So really what we're focusing on now for both our K-12 and our ECE teams is that transition from response to recovery. So we do know that vaccination rates are plateauing for our pediatric age groups 5 and up who are eligible. We're still waiting for those ECE populations for the 6 months and up. We know that positivity rates at our COVID check sites from the schools are at record low. I believe the latest positivity rate from those sites, which I believe have about 3,000 students that are tested, the positivity rate was 0.1%. So seeing some pretty low rates coming out compared to a high of 19% during the Omicron peak, for example. So what we're working with now is sort of resetting and refreshing how we respond to communicable disease, especially as with mask removal, we're seeing things like RSV crop up, pertussis, some of these illnesses that were really mitigated with our COVID efforts. And so we're working with our school health professionals to decide, what's their role versus what's public health's role as we respond to COVID. We're working with our childcare centers, our ECEs, as they're seeing increases in a lot of upper respiratory disease, on what sort of is that standard procedure for going back to working with their health consultants or their nurse consultants. What does it mean to work back into this sort of standard operation of communicable disease response? Overall, in our conversations with our partners, they've shared that the removal of masking hasn't led to a lot of the bullying or concerns or other pieces that we were maybe worried about seeing in the school settings. And so that transitioned into this recovery and sort of this new normal in our school and ECE settings has been going fairly well as far as what we're hearing. So I believe that is all the pieces I had for you this evening.
Thank you, Heather. Thank you, Steffi. And then
I
think it's Carol.
Yeah.
Hi, Carol.
Hi. Good evening, everyone. I'll be presenting our recovery planning and contingency planning update for Chris Campbell, emergency manager, who couldn't be here this evening. So next slide, please. So right now we're in the process of demobilizing the fairground site in Longmont. Vaccinations are going to sunset on March 20th and testing is going to sunset on March 31st. We will still continue to have Stasio site open and our testing in Nederland every week. Stasio is right now still one of the busiest community testing sites in the whole state. And so we're happy that that's going to continue. And both Nederland and Stasio are confirmed to continue at least through April. And we're working with CDPHE to continue to provide access to rapid antigen test to community-based providers. And we're aligning our efforts right now with the state roadmap by planning for a fall surge and planning in general to ensure our staffing resources are able to expand or contract as needed for emergency response or other emergent communicable disease needs. Next slide, please. So vaccine equity very much remains a priority focus area. Currently, the bulk of our efforts are meeting with youth and youth providers to co-create strategy around vaccine education. We're continuing to engage with BIPOC and other priority populations. And we also have a plan in place in anticipation of the emergency youth authorization for the 5 and unders moving forward. And of course, our BCPH clinics continue and are also focused on vaccine equity. Next slide, please. So as Heather mentioned in the K-12 ECE update, we are working in conjunction with our state and local partners to establish what routine response for COVID and other communicable diseases is going forward, or resetting, I guess, the other communicable diseases. And that's the case for not just the K-12 VC sector, but also all of our other priority sectors. And we're also evaluating our surveillance update cadence with our partners who rely on that data, and will likely be reducing the dissemination cadence. For example, biweekly emails instead of weekly for certain partners. And that would be most likely once we return to those moderate transmission rates, which we're headed in that direction, but not there quite yet. And then we would, of course, ramp back up if needed, if we see any signals or shifts in the conditions that are important. We would immediately alert our partners. And our plan is to remain ready for any future surges or shifts in conditions that are going to require us to pivot back into response. And at this time, we're engaging in action planning to prioritize our areas of focus in alignment with our staffing resources and the state and CDC guidance, and be able to maintain or scale our preparedness, prevention, and mitigation activities. Next slide. This is just sharing the site at the fairgrounds. This information is also available on our website, and this is the site that will be closing on March 20th. And then our final slide, please, is our free mask initiative continues and is ongoing and is still available out in the community. And I believe that is everything we had for the COVID update, and I'm sure everyone in the group is happy to take any questions if there are any.
Well, still a lot going on, obviously. I know that it's everything looks pretty good at the US and county level, certainly. But it is still out there, and some countries are seeing a rebound off of their lows after the Omicron. So I'm glad to hear that contingency is still being there. The CDC guidance probably would mean that we wouldn't snap back quite as quickly unless the resource load was too demanding. So something to pay attention to, but really appreciate all the efforts of everybody involved in putting together this information, tracking it, outbreaks, the outreach. It's just been a monumental effort. So thank you.
You're welcome.
Doesn't look like there's any other questions. So, and then I have a question, but I think it would be more for old and new business. It's just a process question, but I'll reserve that for now. Okay. So item 6 on the agenda, Marshall and Middle Fork fires, situational awareness and BCPH response.
Thank you, President Thomas. We have Environmental Health Division Manager Joe Malinowski, as well as Air Quality Program and Healthy Homes Coordinator Bill Hayes, here to give the Board of Health an update on the Marshall and Middle Fork fire situational awareness and BCPH response. Mr. Malinowski.
Good evening, Board of Health. Good evening, Board of Health. This is Joe Malinowski. I serve as the Environmental Health Division Manager. I have with me Bill Hayes, the Air Quality Coordinator and the Healthy Home Program Coordinator, to provide an update on the Marshall Fire. Let me see if I can share my screen. It's telling me I can't share my screen while other participants are sharing.
You should be good to go now if you could just give it another try.
Can everybody see that okay?
Yep.
Excellent. Before I get started, I just really wanted to take a moment to thank the staff that have been working on this, particularly the air quality and healthy home team and the water quality team that have really been answering a lot of the questions and addressing the concerns from the community and providing a lot of information that you'll see here momentarily. And I also want to give a special shout out to our communications team, especially Sean, who's been doing a lot of work lately on getting a lot of information up that, again, for the community to help keep it safe for the recovery. So just what we're going to focus on today is just we're going to hear about some soil testing we're doing. We're going to continue to talk about some of the outdoor air concerns that are still out there, some of the healthy home things we've been working on. Then I'm going to talk a little bit about the water quality and some of the stormwater efforts we're doing around hydro mulching. And then I'll also talk a little bit about the post-fire communications that we've done, and then open it up for questions. So without further ado, I will turn it over to Bill Hayes.
Thanks, Joe, and thanks to the board for letting us give you the update this evening. I'm Bill Hayes. I'm the Air Quality Coordinator for Public Health, and start off talking about the soil testing that we have been doing. So Boulder County Public Health contracted with Environmental Restoration to perform sampling at 26 locations. 20 of those are within the burn area on properties where homes were completely destroyed. And we've tried to spread those throughout the burn area, kind of proportionate to the damage. We've got an additional 6 locations outside of the burn area to provide us background levels. And we chose those locations based somewhat on soil types, knowing that we've got a variety of soil types through the burn area. We've got sandy loams where heavy metals might migrate quicker than if they're on a clay surface. So with a fairly small sampling size, I think we're going to get some good data from that. Environmental Restoration conducted all of the sample collection this past week, and we should have all of our sample results back by the end of this week. And so we're testing at each one of those 26 locations. We're collecting 4 different samples. We're sampling at depths from 0 to 3 inches, 3 to 6, 6 to 9, and 9 to 12 inches. So they've pulled samples from each of those 4 depths, but have only submitted the 0 to 3 inch and 3 to 6 inch to the lab for analysis. And so we're going to look at those results, and if we're seeing metals migrating beyond that 6 inches, then we'll submit the additional samples for analysis as well. But trying to do that is a bit of a cost savings measure. And so we'll be testing for asbestos as well as heavy metals. We are using the California Title II list of heavy metals, and so that includes a total of 17 metals. Right now in the county's contract for the community-led debris removal, they're only planning to test for RCRA 8 metals, a smaller subset, and we're hoping that this sampling effort that Public Health is doing will tell us whether just sampling for the RCRA 8 metals during cleanup and debris removal is adequate, or if we should consider adding additional metals to that list. So we're coordinating closely with the town of Superior and Boulder Valley school districts on this sampling effort. The town of Superior hired Opinion Environmental to go to the 8 public playgrounds in Superior, and they just did superficial testing. So they did swab and tape samples off of all the hard surfaces of the playground equipment, and then they did surface grabs in the pea gravel and the wood mulch in the playground areas. And they only tested for ash, soot, and char. Again, as a cost savings measure, their thinking was that if we, first determine, do we have significant ash, soot, and char? If so, then we can go back and test for specific pollutants of concern. And so out of their 8 parks, they only had 1 that showed any significant amount of ash, smoke, and char. The one park that did have a significant amount was the Founders Park, which is, if you're familiar with Superior, it's just north of their town hall, west of McCaslin, pretty much straight south of the Target in the Superior shopping plaza there. And so just immediately west is where a lot of the older homes in Superior, the original homes, burned. And so that park did receive a good bit more ash deposit and smoke exposure than the other parks. So we may go back and do additional sampling at that location. Then Boulder Valley School District, Joe and I have worked closely with them to determine what would be appropriate to sample for. At the 8 schools within the BVSD system in the burn area, none of them showed any signs of visible ash accumulation. And so we didn't think it necessary to do bore samples, but to just sample what's on the surface. What we're really wanting to know and what the parents are asking is it safe for my child to go to school, play on those playgrounds, play on those sports fields? And so by doing the surface scrape, we'll know, what is actually in that surface material that kids could come in contact with. And we're also expecting to hear back on those results this week. So we're hoping by the end of the week, between these coordinated sampling efforts, that we'll be able to give better guidance going forward to answer those questions of, is it safe to be in my yard? Is it safe to play on the playgrounds? And so in that regard, we worked, again, as Joe mentioned, Sean Hollister and our communication team has just been great to work with. And Sean developed this flow chart on the right to help answer the questions that were, I'm not a gardener. And so I was kind of scratching my head that it's only March and people are already thinking about gardens, but talking to friends, people have got their seed pots going in the kitchen and want to get them in the ground soon. And so folks are asking, what is the risk if I plant in a flower bed, a garden bed that got ash, that got smoke exposure? So we developed a flow chart to determine whether you were in a high risk area, a moderate risk, or a minimal risk area based on where you were in the burn area and how much smoke and ash exposure you had. And then once you determine your risk level, then we have measures to take to mitigate those risks. So in the high areas, it might be removing the first couple inches of soil from your garden. In the minimal risk, it might just be adding more nourishments to the soil. So the cooperative extension out of CSU, we've worked with them for years to help gardeners analyze their soils, but they're looking at pH of soil and nutrient content, not really looking for heavy metals, other toxins, but we're talking with them to see if we can help identify a protocol. They're receptive to accepting samples of soil from people with gardens in the burn area, but they just have to figure out what's the correct protocol for collecting and analyzing those samples. But that effort's going forward as well. So next slide, Joe. I don't know, do we want to answer any questions on soil testing before I jump to air quality, or?
I thought we'd save it to the end, Bill.
Okay, so outdoor air quality, as we reported last time, the VOC levels that we're seeing are low and continuing to dissipate. We've had NOAA drive their very extensive air monitoring van through the burn area twice. CDPHE's driven theirs through the burn area once. NOAA has agreed to support City of Louisville and drive through the entire burn area 2 more times. And we're kind of waiting until debris removal activity starts, because what we want to see is, right now we know the VOC levels are low, but we want to see if once we start disturbing that soil with the debris removal effort, if that's liberating anything. But so the particulate levels continue to be our long-term concern. I told you last time, we'd had pretty much consistent snow cover since the fire and low winds, but we're expecting as temperatures increase, the ash dries out, maybe winds pick up, that we could have issues with the particulates. And sure enough, this past week with warming temperatures, not much snowpack, there was a couple of days that we saw the AQI, the air quality index, go from the good level just into the moderate level. So not a high concern, but it did demonstrate that when things dry out, those particulate levels are going to increase. So right now we've got 6 monitors in the burn area that we're looking at every day, and I'm very happy to report that I came home from the office today trying to get this in focus with me, not blurred, And I have 10 large boxes sitting on my front porch containing 20 more air monitors. So my team tomorrow, we're getting together, having a big party and configuring air monitors. And by the end of the week, my hope is that we'll have a total of 25 working air monitors in the burn area. I sent an email immediately to Molly McLaughlin, the facilities manager of Boulder Valley School District, and told her Thursday, let's get on top of all of the schools and get the monitors set up there. We have one on Monarch High School right now, but we'll put an additional 7 on the other schools in the burn area. So I'm really excited that we finally got these and that they're going to get out there this week. The data, also hopefully by the end of the week, we do have a mock-up of the of the website that we'll be displaying the data on, but I can't show it to you quite yet. As soon as it is live, I will send all of you a link so you can check it out. But we're using the Denver Public Health's Love My Air platform. Montrose Engineering, who maintains that website for Denver, has been great to work with, and they've allowed us to customize and put Boulder County Public Health logo on it, make a Marshall Fire specific landing page where you can see the average of all the monitors. It'll have a map, and you can click on any one of the individual monitors, figure out which one's close to your home, and see the specific information just from that one monitor. It'll look very much like the airnow.gov site, in that when you first go to it, it'll have the gauge going from good to moderate to poor to serious air quality. And we will be providing the same messaging that EPA provides on the AirNow website as to what precautions, what populations need to take based on that air quality index. And then we will also have a function on there where people can sign up to receive push alerts when air quality gets into those moderate or serious realms. So really excited about that, and I'm going to really look forward to the next meeting showing that off to you all. So that's outdoor air quality. And indoor air quality. So yeah, we can jump past this. So indoor air quality, as I said, we've just like the outdoors, we're seeing VOCs continuing to dissipate. We're working closely with a handful of researchers at CU that have monitoring equipment inside several homes in the burn area, and they're really trying to categorize, what those VOCs are. Initially, we were all scratching our heads thinking the levels were higher, and somebody said, well, we should go into homes not in the burn area and see what the levels are in a normal home. And so that effort is still going on to kind of give us a baseline. We're trying different methods of different air purifiers, different air filtration units to bring down those VOCs so that we can give good guidance to folks on that. So I'm really excited that we have a certified industrial hygienist back on our staff. Mike Richin, he worked with us at Public Health from 2004, retired in 2017. Just a wealth of information in this area. But what I really, appreciate most about Mike is he really listens to people's concerns and has a great way of, conveying information to them that really helps reduce their stress levels. So he's with us 20 hours a week through March. Great to have him back on board. Primarily what he'll be doing is working with homeowners who are going back to their intact homes to navigate. There's, a lot of different information coming out of remediation companies and insurance companies that aren't always the same information. And he's just really going to be able to help folks navigate what's appropriate, what isn't necessary, what's a good cost. So right now, we're pretty much filling up his time with calls that continue to come in to our front desk at Public Health or through our health info email line. But if he starts to have hours available, we may look at doing some promotion of that service. So that's my update. Thank you all again.
This is Joe Malinowski again. I just wanted to share some of the work we're doing around water quality, and it actually it leads into some of the air quality issues as well. I think this picture really sums it up. But before I start talking about the hydromulching, I did want to shout out Scott Coulson, who's our stormwater program administrator for the county. He's just done a great job working with Public Works to coordinate this important effort to try to stabilize the waste out on the burn site. And what you'll see here is you can see this green in the background, and what it's done, it's a substance you spray out that it actually causes almost like a hardening of the surface, encases it, and keeps it from both blowing away. If you think about it, this area is all exposed to high wind, so it tries to encapsulate it that way. And then also, if you look at this picture, what we're really worried about is you get rainfall and all the driveways go right to the driveway where we think most of the hazardous waste in the house is kept, and it slopes right out to the street. So if we get a significant event and didn't have this hydromulch, we worry about it coming down the driveway and then coming to the storm drain. And you see some of the precautions they've put in just in case some of it does escape. But it's been really challenging working with all the homeowners, but they've really been successful at doing almost 700 homes that actually had hydromulch applied to it. Here's another picture of, I think it's the next house over, that really you can see the green color of that hydromulch that really, again, encapsulates the waste and keep it from blowing and both running off. I also wanted to, again, just highlight some of the information we've been doing on communications and the great job that team has been doing, but just doing a plethora of information around outdoor air. You heard Bill talk about that. Again, those air quality notices. He's doing the complete format of what Love My Air will finally look like, that platform when it goes live. Doing information for outdoor, for parks and open recreation, so that people take precautions. They may be hiking in the area. And then just, again, a lot of information about healthy home, indoor air, ash and soot cleanup, well water precautions and testing, selecting a contractor, and some gardening guidance that we talked about earlier. And then what's come out of this is another flow chart, much like you saw on the soil gardening. This is one around well safety. And it just gives homeowners that were impacted by the fire that actually are on a private well some things to think about if their well is impacted, and if it was, some of the testing guidance that they should be doing to make sure their water is safe. So that's really our update, but Bill and I'd be really happy to take any questions that you may have. Thank you.
Thanks, Joe. Thanks, Bill. What do you envision as the timeline? I mean, because I know this rebuild can take years, right? But what do you envision as the timeline for like sampling work window?
So we did complete our sampling, but the actual debris cleanup, I know there's been a delay with there's been some lawsuits around the contracting for that. But as I understand, even with those delays, we still expect to finish all the debris cleanup by mid to late July. And then the rebuilding, will take some time after that. But there are fast tracking some of the building and planning is fast tracking some processes to help folks navigate the process, so it should be a little quicker.
And I would add that the monitors that we're deploying in the burn area, it's a subscription service, and we have a 1-year subscription with Clarity. So we don't actually own the monitors. We're paying for their data processing and pushing service. And so at the end of 12 months, at present, we would send the monitors back. So hopefully, in a year's time, the debris removal process will be well completed, and we'll have some assurances that the air quality is acceptable in the area and that we don't have significant concerns. If a year from now we're still seeing significant resuspension of ash or other materials, which is very likely given, that this is going to go from a debris removal to a large construction effort. But we are purchasing purple air monitors as well, about 30 of those that we will own. And so, we may in a year's time switch from the Clarity to using purple air monitors for that purpose.
Thank you. All right, I see no other questions. Thank you, Bill. Thank you, Joe, for your ongoing work. And let's hope for a nice clean spring.
Thank you.
All right, let's see, that brings us to item 7, which is the director's report. Are there any pressing questions on the director's report?
I had a question on the flu immunizations. It was a bit tough to tell based on the table that was presented. Are we lagging far behind previous years for flu vaccinations this year?
Thank you, Member Harrison, for that really good question. Carol, are you still on to be able to expound on that portion of the director's report?
Yes, hi. I don't have the flu vaccination data at my fingertips, but I'm happy to get back to that, share that back with Camille so she can get that information to you.
That would be great. Thank you.
Thank you. We will get back to you.
And I had one other question. So under the Works program, when it tallies the referrals, what are the referrals referring to?
I'm happy to take that. As I used to work with the program, I haven't in the past couple of years, but I'm very familiar with it. I do know that the team refers to treatment, to case management, to housing or food supports, a variety of different services that are out in the community.
Got it. Thank you.
Mm-hmm.
Just to clarify, I think
Go ahead, Lenny.
I think Brooke's question was about, was it referrals in or referrals out? And it's in reference to referrals out. How do we support folks who present?
Yeah, I was curious if it was looking at drug treatment or housing. So yeah, I see that. Thank you.
This is Lindy. I just wanted to ask, and I apologize if this was covered previously, but the Valmont power plant closure, it sounds like there's a meeting with Xcel Energy in March. Is there a reason that meeting's getting scheduled, or is that just a regular occurrence? I'm just trying to understand the issue there and why we're engaging.
Sure, this is Joe Malinowski. The Valmont power plant was decommissioned, so it's no longer providing power. But over the years, they burned coal. There's a huge coal ash pile out there, and they're talking about doing a beneficial use for that. So part of it is the discussion around the beneficial use. They're going to use it to mix with some concrete materials and ship it out to be used with concrete, which actually is a pretty good, probably the best way to do it. It's either that or leave it there. So we're having some conversations about the use of that. And there's some hoops they have to jump through with planning and permitting to make that happen, and probably some air quality issues because it's much like a little cement plant. But the other issue is there's also some groundwater contamination offsite that's migrated offsite, mostly selenium, and I think arsenic might have been another one. They've done some well testing with the private homes that are just north of there, and I think they've detected it in one of the homes, and they're offering bottled water, and they're doing some additional follow-ups just to see how far that plume is actually spread.
Okay,
We're
thank you,
making-
Joe.
And we're just making sure that we're aware of what's happening and we're informed and that the community is aware of it as well. Thank you.
All right, any other questions? Okay, I'm moving on to old and new business. So I had a question, I don't know, it's for the attorney. Hold on a second. And so I'm just kind of curious about what the outlook is for the board getting back in person. What needs to happen from a county perspective for us to even consider that?
President Thomas, this is Camille. I can start. I know that I wouldn't want to answer anything about the bylaws specifically, and that could be an attorney answer. But logistically, you should know that we are working hard to ensure that the spaces where we can meet in person have hybrid capability. We've noted that many of our partners in the community, like city and town councils, and even our commissioners, are offering not only obviously in-person opportunities, or at least some of our partners are starting to plan for transitioning back to in-person city and town council meetings, but also that in respect for those individuals who may happen to be immunocompromised or just choose to prefer to not be in larger crowds, to still be a public participant. We wanted to make sure that our meeting spaces had the hybrid capability. The challenge we have had with that at this point includes supply and demand, as well as the need for many of our conference rooms at the Boulder campus, which is an older building, to be rewired to take on all of the equipment that needs to be installed to allow for us to have these kinds of meetings where some of us are in person and maybe some of us, especially our public, could still have the option to participate remotely. So with that said, that doesn't answer anything about the bylaws particularly, but it does let you know that we are working hard behind the scenes at Boulder County Public Health, as well as in conjunction with our other partners that we share spaces with, to get those rooms and meeting rooms and spaces ready for that very important moment when we can all be there together, but also still offer the hybrid option. I'm not sure if we still have an attorney on. I know Kate Haywood wasn't able to be with us this evening. I believe Erica was supporting. Hi, there you are. Yes.
Yeah, this is Erica Rogers from the Boulder County Attorney's Office. And I can take a look at the bylaws and make sure that we have everything in place, and I can send you a follow-up on that. Because it sounds like if that's something that's going to happen, we can make sure we do everything procedurally correct.
Thank you, Erica. I hope that starts to answer your question, President Thomas, and it's something that—
Yeah, it does. And I mean, I do. Yeah, no, I do think that the hybrid option for public participation certainly is, that's an important consideration, right? And so, I'm not necessarily advocating for April, but we can talk about this next month. I just figured I'd put out the legal questions first, and then we can go from there.
That's perfect. And just
Okay.
know we're actively working behind the scenes on the other logistical issues, because they are taking some time, but we're certainly hopeful that in the next month or two, we'll have those resolved as well.
Great, thank you. Any other old and new business? Okay, so item 9, we don't do these very often, and I think it's my first one that I've done my 10 years on the board. But I think we are going to adjourn into executive session as pursuant to Colorado Revised Statutes 24-6-402 sub 4 sub F for personnel matters to develop a staff feedback survey as part of the Boulder County Public Health Executive Director Performance Review. 1 year anniversary is coming up in June. And we only get to meet monthly, so thought it would be timely to do this now with the hopes of getting something out in March and then having ample time to receive feedback and then condense it as needed. Let's see, Erica, there is an option, right? Camille could certainly ask that this meeting not be an executive session, isn't that correct?
This is Erica Rogers. I would need to look into that. I don't know the answer to that off the top of my head.
Okay. Well, I don't know if that came up, Camille, but I know when I was asking about executive session process, I believe Jana Peterson had said that that's an option. I don't know that you want to do that, but anyway, I just kind of, that's what I had heard. So I'll just throw that out there.
Thank you, President Thomas. I'm very familiar with having portions or my entire performance evaluation occur in executive session. So I'm supportive of that strategy. It doesn't,
okay.
So thank you for asking.
Okay, thanks. Okay, board members, you have an invite for Teams for starting at 7:30. Why don't we take 5 minutes and then we will start executive session at 7:42. Okay?
Is that that's a separate link then?
It's a separate link. Rita sent that out.
Okay.
So hopefully you see it in your calendar. If not, check your deleted emails or your inbox.
Okay, thanks.
Okay. Hey, thanks everybody. Keep up the great work. We appreciate you.
Thank you.